Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
I'm great, Jordan. How are you?
Good. So today I wanted to talk to you about a more permanent fix to someone's face that they might be interested in having other than injectables like Botox or fillers. What more do you offer for someone whose skin on their face might be sagging or have a loss of volume?
Beyond fillers, a non-surgical approach is a treatment called Ultherapy. Okay, Ultherapy uses sound waves that are focused beneath the skin to create heat and can provide some tightening. Now, this really only works in younger people who have really good skin tone, but it's a way to non-surgically provide some tightening. Our skincare nurses or the doctor can evaluate you and decide whether you're a candidate for that non-surgical approach. Beyond that, we're looking at some sort of facial rejuvenation procedure, like a facelift or a neck lift, something along those lines to help rejuvenate the face.
Okay. So who would you say would be a good candidate for a facelift?
So I think a good candidate for a facelift, somebody who's healthy, who has some jowling and some loose skin about the neck. That's really what a facelift, a neck lift are addressing, loose skin about the neck and the jowl area.
Okay. And there are different variations of facelifts from what I understand, depending on what area you're having treated. I read about a standard or a full facelift or more of a limited facelift.
Sure. The terminology is incredibly confusing, even for plastic surgeons. And there are a number of procedures out there. There's mini lifts, there's facelift, there's neck lifts. There are trademarked facelifts where people have branded a name to a certain facelift. But the bottom line is facelifts lift some aspect of the face. And there's facelifts that treat the neck only. We typically would call that a neck lift. Or a facelift generally is improving the jowl and the smile line comes down the middle of the face.
Okay. So how exactly is that surgery performed? Where do you make incisions and how?
It's surgery that usually requires some element of anesthesia, but it's all outpatient surgery. You go home the same day. And these are things that typically we would perform in our own operating room. We have a licensed surgery center in our building. Generally, the procedures all involve incisions that are hidden back in the hair, in and around the ear. So things are pulled upwards behind the ear, around the ear, to lift the face and the neck upwards. Typically, extra skin is removed. So just like in the mirror, when you pull your neck up and you bunch up all that extra skin around your ears, all that extra skin is removed. Things are sewn up, and incisions are typically hidden behind the ear and in the hair.
Okay, great. So you said that typically the anesthesia, it can be either local or under general anesthesia?
Yes, most people require some element of anesthesia, whether it's twilight anesthesia, something you might get with a colonoscopy, for instance, or sometimes the patient's just completely asleep. And the patient and the doctor can, discuss all the alternatives and come up with the best anesthesia plan for the patient.
Okay, great. And so what sort of recovery time is involved in this procedure?
That's a good question. So generally, facelift surgery, I think, has a pretty easy recovery. It's typically not a real painful procedure. And again, all the incisions are designed to be hidden in the hair, so you don't really see the incisions. I tell most patients they're usually back socially and working within 7 to 10 days. These days, with working from home, patients might be back even quicker. Yeah.
Okay. Would you say there's more benefit to having a surgical facelift versus just a liquid facelift?
For younger patients who don't have a lot of extra skin, I think a liquid facelift might be a good alternative. But for folks who have loose or hanging skin or a significant jowl, they're probably better served by having a facelift procedure.
Yeah. Would you ever combine some fillers to give more volume with someone who's already had a surgical facelift?
Sometimes we do add fillers after a facelift. Now, facelift surgery itself is designed to lift up the tissues and get them back up onto the cheekbones. So it will volumize the face. But there are some people who need extra volume and typically will add some volume, probably not during the surgery, but easily soon thereafterwards we could add some volume with some fillers.
Right. And what would you say is the typical cost of a facelift?
That's a good question. Facelift surgery with the anesthesia and the operating room charges, you're probably starting at something approaching $7,000. The high ends might be in the $9,000 range.
Okay.
And there's a little bit of a variation because the procedures themselves can vary quite a bit.
Right. All right. Well, thank you for your time today.
All right. Thank you, Jordan. Good questions.
Thanks. That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.